Assalamu alaikum. My name is M Kamran. Today I am going to present you a case study of paraphimosis of 7-year duration in Australian. First, discuss what is the paraphimosis is. Paraphimosis is the inability of the stallion to retract penis into prepuce. There are multiple causes of paraphimosis like trauma, infection like herpes virus, drugs like acepromazine. The side effect of acepromazine give the condition of paraphimosis, priapism, rabies, and debilitation. It leads to edema, nerve damage, and permanent penile paralysis. Prompt treatment is essential to prevent the irreversible damage to the penis. There was a 15-year-old Percheron Stallion with 7-year history of paraphimosis after kick injury. It was present at the University of Veterinary Teaching Hospital at Alabama. Penis and prepuce both was fibrotic as you can see there in the image. Edematous and lack of sensation. There was no sensation in the penis. Vital sign and hematology was in the normal range. Blood test reports were normal, PCV 32%. Partial phalectomy and castration was recommended by the doctors. When we physically examined the Australian, the penis and prepuce was markedly fibrotic, swollen, extended to the distal torsus. Epithelium was thick, febrile, and pooled. There were no sensation on pinch test indicating nerve damage. Recommendation by the doctor was due to chronicity and lack of sensation. Partial phalectomy and castration was recommended. Surgical treatment was done. Preoperatively, gentamicin 6.6 mg per kg was given, penicillin as an antibiotic, and flunixin for pain management. For sedation, we use xylazine, propofol, ketamine maintained with isoflurane as a gas anesthetic. Williamson technique was used for partial phalectomy. Urethrostomy created and penis amputated 5 meters distal to the site. Close castration was performed concurrently. Surgical steps of Williamson techniques are, first of all, we give general anesthesia, then electrocautery and S-March tourniquet for hemostasis. Urethrostomy was performed. Urethrostomy is a triangular incision on the ventral penis, sutured mucosa to perpetual epithelium. Amputation distal to urethrostomy was given. Then castration was performed with sera emasculators. Penis stump was replaced in the prepuce. Mild hemorrhage was noted but stable initially. These are the post-operative picture after we perform phalectomy to this horse. This is on the left side color photograph of post-operative swelling on the penile stump and color photograph taken when the horse recovered completely after the surgery. There are certain post-operative complications that was appeared. There was a mild hemorrhage, swelling post-surgery. 12 hours later, a dullness, pale mucosa membrane, and tachycardia and tachypnea was observed. PCV was dropped from 22% to 18%. Then we treated aminocarponic and aminocarporic acid infusion, formalin, and blood transfusion was performed of 7 liters. PCV was improved to again 22%. Then we discharged the horse after 5 days. We follow up the case 4 days later. Mild tachycardia and urethrostroma was observed. Then we treated it with phenylbutazone, trimethoprim sulfa, and famicin ointment. The horse was fully recovered within the month and returned to work after the saddle. From this case, we mm, discuss that chronic paraphimosis requires surgical management when fibrosis and paralysis occur. Differentiation from parahism is critical. Multiple surgical techniques exist like Winsott, Scott, and Williams. Williams technique minimize the urethral stricture formation. Combined phyllectomy and castration increase the hemorrhage risk. From this case study, we conclude that paraphimosis, if treated, it leads to irreversible penile paralysis. Partial phyllectomy effective in chronic cases. Close monitoring and supportive therapy is essential post-operatively. Horse recovered fully and returned to its normal activity. These are the references of this case study. Thank you.